Hi, this video recording is for the Unit 14 discussion, Telebehavioral Health, Competence, and Reflection. Number one part, the first part is what did I expect to learn in this course? I expected to learn digital communication skills, further auditory and visual skills, what to do if technology fails during a session, ethical and cultural limitations, and what to watch out for, when is best to use video version versus phone version, how to best deliver clinical services electronically, how to go about the initial paperwork and the process of getting started in a digital session. Then part B to question number 1, how do my course expectations and outcomes align or differ? I feel that my course expectations were fulfilled to the full extent. I felt that all of the aspects of telehealth that I would think would be touched on were spread out throughout the various assignments. There was nothing substantial that stood out to me that different from my expectations going into it. Number 2 is in Unit 4, I was asked to sign up and attend at least 2 telehealth sessions. The 2 telehealth sessions that I was set to attend was the one on September 14th at 10 a.m. Eastern Time, but I missed that one due to mixing up the time and jumping on at 9 a.m. thinking Central Time instead of Mountain Time at 8 a.m. So I missed it by an hour, but still posted to the discussion board with all of the notes I already had ready to go live, and I am prepared to join the second one on October 5th coming up at the same time. Number 3, how has my competency in telebehavioral health changed and result of this course? I was pleased with how I scored on the telebehavioral health competency screening checklist. I ranged between the 2, 3, and 4 categories from some knowledge skill to moderate, whereas before I might have sat more in the no to minimal knowledge skill and training, therefore reassuring me that my confidence level has gone up past the point of being more unsure and hesitant. Number 4, what are 3 smart, strategic, measurable, achievable, realistic, and time-oriented goals that I plan to implement to continue my telebehavioral health training? Number 1, I will attend 1 through 2 sessions about telehealth for the upcoming 6 months to better support my patients with training on the basics and beyond the basics. Number 2, I will visit my local library at least once every 2 weeks for the next year to rent material to read up on that include cultural sensitivity and accessibility requirements. And number 3, I will pick a day in the week to go on my computer to look up online articles to explore on shaping a telemental health practice for the duration of the next 3 months. Question number 5, identify at least 1 continuing education or information resource that will help me maintain or develop further telebehavioral competence. One organization that I found is one for telehealth education for healthcare providers. It's called capital NCAHEC, Telehealth Education. It has webinars, virtual learnings, and continuing education courses on telehealth available. And educational credits are also available, so it seems like that would be a good resource to go with. Number 6, what is 1 ethical consideration related to telebehavioral health that I feel will be critical to my future work in this area? The top 3 ethical considerations and standards related to telebehavioral health that I feel will be the most critical are 3 that are in section H4, distance counseling, technology, and social media. And then within that, H4 distance counseling relationship, that subcategory. The 3 standards are H4A, benefits and limitations, H4B, professional boundaries and distance counseling, And H4F, communication differences in electronic media. And then question number 7, what are 3 takeaways I have from this course? Number 1, I have overall learned to consider the differences between electronic communication and face-to-face communication and its presence and how they could potentially affect the whole counseling process. Number 2, I've taken away that I as a counselor will need to make efforts that are reasonable to make the determination if clients are capable of using the application in different ways, such as if they're ready for it intellectually, if they're emotionally, physically, and functionally there, and that the application is also appropriate for the client's specific needs. And then number 3 would be that I should check on a regular basis that the actual electronic links are working and are appropriate professionally. And then question number 8 was, and finally, what advice would I give to someone considering this course as a future elective course? I would encourage and recommend this as an elective course to any counselor in training who foresees themselves working with clients at a distance to have some training under their belt, and especially since telebehavioral services and technology in general is progressing so much, I think that it would probably boost your appeal to an employer seeing that you are well-rounded in that way. Thank you.